What if I told you one of the most contaminated pieces of equipment in the operating room isn't a scalpel, isn't the anesthesia machine, and it isn't even the floor? It's probably sitting in your pocket. We have become obsessed with sterilizing surgical instruments and wearing sterile gloves and maintaining aseptic technique. But there's one object that almost nobody thinks about: our cell phones. And unlike surgical instruments, most phones are touched dozens of times a day, but rarely disinfected. If you look at the human hospital data, the research is surprisingly consistent. Study after study in human hospitals has found that between 85 and 95% of healthcare workers' phones are contaminated with bacteria. One of the landmark studies cultured the phones of 200 healthcare workers. Nearly 95% grew bacteria. And some of those organisms included MRSA, one of the most concerning antibiotic-resistant bacteria we encounter in human hospitals. What was even more interesting is that the bacteria on the phones closely matched the bacteria found on the healthcare workers' own hands. In other words, every time we touch our phone, we potentially are recontaminating our hands. A later study specifically looked at operating room personnel, and the researchers cultured the staff's noses, their dominant hands, and their mobile phones. Almost every sample contained bacteria. Using genetic fingerprinting, they showed that the same strain of Staphylococcus aureus was often present on the person's nose, hand, and cell phone. That's powerful evidence that our phones become extensions of ourselves, literally. They're constantly exchanging bacteria with us. What about veterinary medicine? Now here's the part that caught my attention. A 2025 veterinary study evaluated mobile phones used inside the operating room of a large veterinary teaching hospital. The researchers cultured 39 phones belonging to veterinarians and veterinary nurses, and 41% of the phones grew bacteria. Now, at first glance, that's actually lower than many human hospital studies, but here's the surprising part, at least to me. Veterinarians' phones were contaminated almost 10 times more often than the nurses' phones. Veterinarians, 62.5% contaminated. Veterinary nurses, 6.7% contaminated. That's a remarkable difference. So they asked the question, why? The study didn't actually prove why, but maybe veterinarians handle their phones more frequently during the day, maybe they're moving between more patients, maybe they simply clean them less often. The study can't answer that, but it certainly raises some interesting questions. If you look at the habits, the survey that accompanied the veterinary study found that more than 3/4 of staff admitted using their phones in clinical areas. More than half cleaned their phones less than once per week. Some weren't using disinfectants at all. And nearly 1 in 4 reported recently using their phone in the bathroom. Think about that. That same phone may later be sitting next to an anesthesia machine or next to an anesthetized patient. Now, does this mean that phones cause surgical site infections? Here's where we have to be really careful. Finding bacteria on a phone does not automatically mean the phone caused an infection. That's an incredibly important distinction to make. To prove that, we need studies showing that patients develop infections directly linked to contaminated phones. Right now, we don't have that evidence. What we do know is this: phones are excellent bacterial reservoirs. They exchange bacteria with our hands, and our hands are already recognized as one of the most important routes for transmitting microorganisms in healthcare. So the bottom line here is, should we ban phones from the operating room? The evidence doesn't say that, but it does suggest something much simpler. If we're meticulous about washing our hands, if we're meticulous about sterilizing instruments, maybe we should just be as meticulous about cleaning the device we touch 100 or 1,000 times a day. Because the dirtiest thing in the operating room may not be the floor. It may be in your pocket. Follow me for more evidence-based veterinary medicine.